Hello everybody, my name is Susie Shepherdson and I'm a first year graduate student at Emory University in the Cognition and Development program. And I'm going to be presenting my poster, The Neural Correlates of Autobiographical Memory Retrieval, a seed-based D-mapping meta-analysis. So I'm going to start with a brief overview, and then if you're interested, stick around for some more in-depth information. So basically, we conducted a meta-analysis of autobiographical memory retrieval and used the largest set of studies to date, as well as a powerful meta-analytic method called SDM. We found largely a lot of areas that were common to the AM network, however, also areas that were less common. And these less common areas allowed us to clarify some contentions in activation that were brought up by previous meta-analyses. We also conducted two supplementary analyses. The first looked at two different autobiographical memory tasks. So we contrasted the neural correlates of rehearsed versus spontaneous AM retrieval and found largely overlapping activity, except for areas that were linked to memory search and difficult cognitive tasks in the spontaneous task. And then we also looked at the autobiographical memory retrieval activations across three different control tasks in order to find the areas that are most consistently activated by autobiographical memory, regardless of their control task. And this allowed us to show that these areas include the ACC and PCC, other frontal and parietal areas, as well as the left middle temporal gyrus. So if you're interested, please stick around and I will go into more detail on each section of this poster. Okay, so I'm going to start with some introductory material. So first of all, autobiographical memory is a type of episodic memory that involves the recollection and re-experiencing of personal life events. There have been many neuroimaging studies that have attempted to identify the neural correlates of AM, so there have also been many meta-analyses trying to find those regions that are most consistently activated across these studies. We found the largest set of studies to date and used a powerful meta-analytic method called SDM. And we also took a look at different control tasks and active autobiographical memory tasks. So moving right along to methods, we used a PubMed search and rigorous selection criteria in order to include 54 final papers in the overall meta-analysis. We then used seed-based D-mapping, SDM-PSI, in order to conduct the meta-analysis. And all images are thresholded using threshold-free cluster enhancement, FWE, and p less than 0.05. Now getting into the overall results of the full meta-analysis. This is our map of the inflated brain showing our overall activations. Largely we found areas that were common to the AM network, including the ACC and PCC, other areas in the frontal and parietal lobes, bilateral medial temporal lobe, and the cerebellum. And we also found areas that were less common. However, we took a look at previous meta-analyses and found that these areas were really only shown in one or two meta-analyses, and the lateralization was generally unclear. This meta-analysis was able to find bilateral activation in all of these areas, and so since this is the analysis with the most power, we were able to show bilateral activation of the superior frontal gyrus, LOC, middle temporal gyrus, and inferior frontal gyrus. So moving on to our first supplementary task, we took a look at the difference in rehearsed versus spontaneous AM retrieval. So we took a look at the original 54 papers and ran SDM meta-analyses on a subset of those. So we identified 15 papers that used a rehearsed AM task, and this is where the cues that were presented in the scanner were created by using an autobiographical interview at most 1 week before the scan. And we identified 13 papers that used a spontaneous AM task, which is where novel cues were presented in the scanner. So here is our activation map. Activations in red are from the rehearsed AM task, activations in blue are from the spontaneous AM task, and activations in green are the overlapping activity. It may seem at first glance that there's not much overlapping activity, and this is largely because of the lack of activity in the medial temporal lobe for the spontaneous task, which didn't make much sense. So we looked at it with a more lenient threshold and did find those areas pop out. So really the only major difference between these two was this activation for the spontaneous task in the left superior frontal gyrus. And this makes a lot of sense considering lateral PFC activation is generally linked to memory search and difficult cognitive tasks, which are definitely part of a spontaneous AM task. Moving right along to our second supplementary analysis, we wanted to assess the consistency of AM retrieval across different control tasks. So we took a look at the 54 papers and identified 3 different common control tasks: visual attention, such as reading pseudo words; semantic, such as completing word association judgments; and imagery, such as doing theory of mind exercises. We then took a look at the overlapping areas across all 3 SDM maps, so SDM meta-analyses of the autobiographical memory retrieval papers that use these control tasks. We took a look at those overlapping areas in order to look at the areas that are most consistently activated by AM retrieval, regardless of their control task. And this is what we find. So essentially, it is the areas that are most commonly known in the AM retrieval network. So this includes the ACC and PCC and other frontal and parietal lobe activations, as well as the left middle temporal gyrus. Now, just for some conclusions, in summary, this SDM meta-analysis utilizes the most advanced meta-analytic method and also has the largest set of AM studies to date. And it allows us to bring clarity to the inconsistencies identified by previous meta-analyses. We also analyzed 2 separate AM retrieval tasks, and this is the first analysis to show that there are very few differences in neural activation between rehearsed and spontaneous AM tasks. And finally, by analyzing the overlapping areas of activation between 3 different types of control tasks, this analysis identified the neural correlates of the most consistently activated regions during AM retrieval. Concludes my presentation of this poster. If you have any questions, I will be here on the online format to answer them. And if you have any additional questions, please feel free to email me. My email is at the bottom left corner of this poster. It is swshepa@emory.edu. Thank you so much for coming virtually to my poster. Thank you. Bye.